So suppose somebody has seen a person developing acute stroke in a public setting. Suppose I find somebody in grocery store having some speech deficit while they're there, and I call 911. And that patient is brought to the ER. What should that patient expect in terms of workup? Can you break down what is the initial stroke workup they're going to expect, and what is the subsequent stroke workup? Do they get to see a neurologist? So all these questions, and when do they get aspirin, and should they eat something? So just from the moment the patient sustains stroke, brought via EMS to the ER, what next?
So if you see somebody in a grocery store having a stroke, the biggest thing that you can do is note the time that this is happening.
That's very important.
As you call EMS, and make sure that they have that information when you give them the details of what happened. Once the EMS brings this patient to the ER, it is extremely important that even if they can, they should not eat. Because there are a couple of interventions that can be done according to the kind of stroke you have that will require you to be empty stomach.
So don't eat.
Do
Write
not
down
eat.
the time of stroke, onset, time of the onset of stroke, and don't eat anything by mouth, as you may be rushed to an intervention.
Especially if the patient is unable to speak for himself. The third biggest thing that you can help out in the acute stroke management of this patient is try to isolate a family member and have them present as soon as possible to the ER who has relevant information about patient's medical history, the medications that take, or what kind of medical problems that they have. The first thing to expect when you present to an ER with an acute stroke is that a clinical provider, a nurse and a physician is going to take your history of your medical problems and the time of the stroke, and then decide based on the risk factors you have, whether it's a bleeding stroke or a clotting stroke. So the first intervention that they will do is a CT scan of the head.
CAT scan of the head.
Which will figure out whether it's a bleeding stroke or a clotting stroke. If it
ischemic stroke.
Ischemic stroke. If it comes out to be a bleeding stroke, the management is extremely different compared to when it's a clotting stroke or the ischemic stroke, as we call it. If it's a bleeding stroke, urgent control of your blood pressure would be the primary thing to expect at that time, and your clinical provider will explain to you what blood pressure parameters that they are shooting for and what agents they are using to attain that control.
The blood pressure.
If it's a clotting stroke, in that case, they will assess you for a couple of eligibility criteria, which they have to check before deciding whether you're eligible for acute stroke therapy, which could be the drug called TPA given intravenously. It can usually be given only up to 3 hours since the onset of stroke in most cases, if you meet the criteria for the drug. But in some cases, the time period can be extended up to 4.5 hours. But the thing that decides your eligibility for that kind of acute stroke therapy is your risk factors for bleeding. TPA is an extremely potent, efficacious drug to help you recover from stroke. But it, like any other drug, it has its side effects. One of the major side effects is bleeding.
Bleeding, because it's the strongest blood thinner that we have.
Exactly, it's a clot buster.
Right.
To help reduce your risks of bleeding from this drug, your clinical providers are going to ask you a set of questions which can be daunting and which can be intimidating. But these sets of questions are essentially focused on trying to figure out if you are a good candidate for this drug and if you have higher than normal risk of bleeding from this stroke. Anything about these, any answers that they get from these questions, like you are already taking blood thinners, or the time of onset of stroke is unclear, or you have you had a recent surgery in an internal organ that increases your risk of having a bleed and it's at a non-compressible site. These are things that are extremely important for us to know when we assess for your eligibility for the drug. If you meet all these criteria and do not have any contraindications or allergies,
and you're within the time frame,
and you were within the time frame, your clinical provider will If he feels confident, depending on the kind of ER you go to, will give you IV TPA himself or herself, or they may decide to consult a specialist neurologist, depending on the availability of that specialty, before they give you that drug. If you, for whatever reason, do not meet the criteria for intravenous TPA, or you present unfortunately to the ER after the 4.5 hours have elapsed, you may still be eligible for another therapy called interventional treatment of stroke, in which they basically put a catheter through the groin and approach and try to open up your vessels from the inside. Again, it is extremely important for the clinical providers to get as much detailed and accurate medical history, especially of the drugs that you take for your medical problems, to assess your eligibility for that. At the end of the day, as your clinical providers try to check your eligibility for therapies, their job is to make sure that you have a good understanding of the risks and the benefits of the therapy.
Risk and the benefit.
And they have made sure that nothing about your medical history or the kind of stroke you have puts you at undue risks where the benefits do not justify taking those risks to give you that therapy. For the unfortunate patients that do not meet either of these two therapies, the criteria for these two therapies, or unfortunately have come so late in the process that they don't meet criteria for either these two therapies, even then there's a lot that can be done to minimize the sequelae of this stroke. If your stroke is big enough to cause a lot of swelling, you can be admitted to the ICU, an intensive care unit, where a specialist group of nurses and specialists will take care of you and try to minimize the side effects. Routine nursing care, things like your ability to swallow, your ability to move around, your ability to, your skin care as you're bedridden, these little things are also given very close attention, and that's why it's recommended that any patient who gets an acute stroke gets acute therapy in the local ER or a specialist ER. And there should be an emphasis on trying to get that patient evaluated or admitted in a stroke unit, where a specialist group of nurses, doctors, physicians and consultants are available to provide good acute post care.
Wow, that's a very vital information. I think, as you said, calling emergently in the timing of noticing time of the acute stroke is ultimately going to determine the most important time window criteria. And then isolating a family member and having a very good history to make sure the therapy offered to you is not going to put you at any danger of bleeding. I think these are, and even if you miss the promptness of the time of arrival, like 3 to 4.5 hours, still there is so much more that can be done and limit the effects, the harmful disabling effects of stroke.
But the 3 core things you can do if you see somebody having a stroke is note the time of onset of stroke.
Time of onset, very
Call
important.
911.
Call 911.
And try to isolate or find somebody who knows good medical history and
Good
medications of the patient.
Medical history and medications, very important. Okay, so now that they have been admitted to the hospital, they have gotten the CAT scan done. I think as a physician myself, as you also mentioned, whenever I see a condition, for example, somebody comes to me and is diagnosed with heart failure, I always try to find out why this person has heart failure. Is it because of ischemic condition? Is it because of vasculitis? So things like that. So I think the same thing goes for stroke, as you clearly mentioned, that we have ischemic stroke where the blood supply is limited and there is atherosclerotic stroke, or there is a bleeding stroke. So finding out cause of stroke is very important. So I think initial evaluation will be to assess the type of stroke and give treatment accordingly. And then the next step will be to find out why it happened to begin with.
Exactly.
Like atrial fibrillation, clotting disorder. Am I?
Yes. So just like you said, once you have sought acute therapy and you are in the process of getting the post-acute stroke care, evaluation of speech, swallow, physical therapy, occupational therapy, your providers are going to start shifting the focus of care to trying to find what caused the stroke. They may order a couple of tests. They may order more CT scans, MRIs, or tests that look at the blood vessels in your brain. They may look at the neck blood vessels by using an ultrasound, in which they can figure out if a plaque caused by high cholesterol in your neck released a small fragment that caused the stroke. They may order some scans for your heart called an echocardiography, which can look at the function of the heart and presence of clot inside the heart.
Inside the heart.
They might be looking at the rhythm of your heart and hooking you to an ongoing continuous heart rhythm monitor to find if you have an abnormal rhythm called atrial fibrillation. And they may order a lot of blood tests to look at high cholesterol, look at tests that help us figure out the control of your diabetes. And if none of these are positive, there are also certain tests that we can send to figure out if you have a genetic disorder or a disease that increases the clotting tendency of your blood. So the providers are going to focus their they may not order all the tests, but they will order the tests that more relate to the kind of stroke you have, and also the kind of factors that the results of these tests will decide what kind of treatment they give you and what kind of counseling they give you that will keep you from having a stroke in the future.
That'll keep you, okay. So these are the things that management, that patient will expect once they're in ER or in the hospital.
Yes.
To find out the cause of stroke. And also vasculitis like SLE may be putting you at risk. So that's what they will figure out in subsequent care.
Exactly.
Now, a lot of our patients who sustain stroke, they have a lot of comorbid condition, including heart condition. And I had a patient who